Hello, I am Dr. Srujan Dasyam, consultant gastroenterologist, NuLife Gastrocare. Today we will discuss about gastroesophageal reflux disease or GERD. So GERD is one of the most common diseases in the field of gastroenterology. So what is GERD? In GERD there is an exaggerated gastroesophageal reflux. We must understand that the reflux is from the stomach or proximal intestine into the esophagus, which is the food pipe or the esophagus. So whenever there is an exaggerated reflux from the stomach or intestine into the esophagus, the symptoms of GERD arises. So what is the prevalence or how common is the GERD? GERD is usually more common in Western countries, but such is not the scenario in the present situation. The reason being, there are more number of cases in our Indian subcontinent as well, because there has been more westernization of the diet and the prevalence of obesity has also increased. That's why naturally the cases of GERD has also increased. So when it comes to percentage, broadly 50% of the general public, they suffer from symptoms of GERD. So now we must understand what are the different causes for gastroesophageal reflux disease or GERD. So GERD is more common in a patient or a person who is overweight. That is, obesity is one of the most important causes for the gastroesophageal reflux disease. So in studies it is proven that the BMI, the increase in the BMI is directly proportional to the gastroesophageal reflux disease prevalence. So the more is the body weight, the more are the patients suffering from GERD. In addition to obesity, there are few conditions or there are few factors which causes more gastroesophageal reflux, which are smoking, abundance in the intake of fried or fatty food, and there are other medicines which also increase the reflux or acid levels, and also excess intake of caffeine or coffee, excess usage of peppermint. All these causes more incidence of gastroesophageal reflux. When it comes to symptoms, so we must understand what are the symptoms of gastroesophageal reflux disease. So here we can broadly divide it into two types, which are the normal ones are classic symptoms of GERD, and apart from that there are other symptoms or extra intestinal symptoms which are caused by GERD as well. When it comes to the classic symptoms of GERD, the most common symptom is heartburn, in which the patient typically presents with few weeks history of heartburn, which is like discomfort or burning sensation in the lower chest region. Sometimes along with the heartburn, the patient typically gives history of reflux of these contents, or there is a sensation of burning sensation starting from the chest, lower chest, and which is going up into the throat region. This is called reflux or regurgitation. Apart from these classic symptoms, there are other symptoms in gastroesophageal reflux disease, which are commonly the patient can have more reflux, can also have vomiting sometimes, and also there is excessive salivation which can result in sour or salty sensation in the throat or mouth, which is called water brash. Apart from these typical classic symptoms, the gastroesophageal reflux disease also can cause extraintestinal symptoms. By the term extraintestinal, it means that the symptoms can present related to the symptoms which are unrelated to the GI tract, of which most common one is respiratory symptoms, which includes asthma. So it is studied that more so in a pediatric patient or more commonly in the obese people, the asthma is also prevalent in long-term GERD patients. So why does asthma happen in GERD? Whenever there is an acid reflux, it trickles into the throat. So the throat is a site where it has both food pipe, and behind that food pipe it also has respiratory symptoms. So whenever the trickling of these acid secretions occur into the throat, some of it might trickle into the respiratory tract, so that it causes reflex spasm or narrowing of these tracts. That's why whenever a chronic reflux patient have, asthma, it is always recommended to look for GERD also, or presence of GERD is usually excluded by performing an endoscopy. Apart from this asthma, other ENT problems can also arise in case of GERD. So what are these ENT problems? It can also cause chronic dry cough, or chronic sinusitis can also happen with GERD. And also patients with chronic reflux, they have dental issues as well. It can cause dental erosions due to chronic acid reflux. So now, after finishing what is GERD, what are the causes of GERD, and what are the symptoms of GERD, let us know how to diagnose and how to treat GERD. When it comes to diagnosis of GERD, usually GERD is a disease which is diagnosed usually based on history, but to rule out other associated complications arising from GERD, usually a gastroenterologist tends to perform upper GI endoscopy, in which the gastroenterologist visualizes the throat or esophagus and also the stomach areas. In the esophagus, usually when the patient has chronic reflux, the GERD patient has features of esophagitis, which is inflammation or swelling of the layers of the esophagus or food pipe, in which we can find thickening or ulcerations in the esophagus. So this is called reflux esophagitis. But not all GERD patients have this reflux esophagitis. Sometimes patient can have a normal endoscopy, but still patient can also suffer from GERD, or patient can present with symptoms of GERD. In such scenarios, the best investigation to rule out presence of gastroesophageal reflux disease is performing a 24-hour pH study, in which we put a catheter above the GE junction or in the food pipe, and we record over a period of 24 hours, we record the pH in the lumen of the esophagus near the stomach junction. So in which it is exaggerated, or the acid exposure in the esophagus is exaggerated. So this test is a gold standard to diagnose gastroesophageal reflux disease, and especially this is more useful when it is performed in a patient with normal endoscopy but still has present symptoms of gastroesophageal reflux disease. So now, after endoscopy and performing a 24-hour reflux study, once the diagnosis of GERD is established, we must know how to treat GERD. So basically, let us divide GERD treatment into two settings or two scenarios, in which first is the medical management of GERD. Whenever the patient presents to us with the symptoms of GERD or a chronic reflux disease, usually we tend to monitor the weight. That is the best advice what a gastroenterologist can give to the patient. So if a patient is definitely found to be obese or overweight, first the patient must focus, in addition to the medical management or in addition to taking medicines, he must also focus on losing weight, because as we discussed earlier, weight loss helps in reducing the reflux symptoms. So the patient has to follow a low fat diet, patient has to exercise regularly, and he must avoid taking high density or high energy dense food, fatty food or fried food. And also advice has to be given on quitting smoking, and also reducing alcohol intake, and also avoiding taking excess coffee. The patient can limit to 1 or 2 cups of coffee, but not more than that. In a patient with typical reflux complaints, coffee intake should be limited to 1 or 2 cups in a day. In addition to that, patient should also be advised not to take excessive chocolate or excessive mint, which can also increase the reflux. So after these general measures are explained, we usually put a patient on medical management, which is we give drugs which reduce the acid levels or prevent the reflux. The drugs are of different classes. So usually a patient is given a trial for 2 to 3 months, and in that period we tend to assess the response. After this, if the patient is still symptomatic, then we tend to assess for any changes needed in the dosage or any further assessment is required or not. Sometimes in a patient with hiatus hernia, so even though we use long-term medicines, the medicines may not show 100% relief. So in such cases, whenever patient has significant hiatus hernia who is not responding to medicines even after few months of usage, what we tend to advise is laparoscopic procedures, which is called a fundoplication. In addition to that, chronic GERD with no major hiatus hernia can also be treated endoscopically. So over the period of last decade, there has been extensive research done in the field of gastroenterology in treating endoscopically. So we have good techniques endoscopically available now to treat gastroesophageal reflux disease, of which important ones are ARMA, which is called anti-reflux mucosal ablation, and GERD-X, which is a technique, which is a novel technique where we use a separate equipment which is passed endoscopically and which is used to plicate or ligate the junction, which is usually loose or lax in case of GERD. So here we must understand that with the advent of new technologies in endoscopy in the field of gastroenterology, the surgery rates has also been decreased, and the recent studies comparing these endoscopic techniques versus laparoscopic techniques have proven to be almost equal when it comes to efficacy wise. So when it comes to endoscopic management in a patient of GERD who is not responding medically, we can safely advise endoscopic management, which includes ARMA and GERD-X, and also only in cases of non-responsive patients with a significant hiatus, then we tend to go for laparoscopic management. When it comes to complications of GERD, what are the complications which can arise in a patient with chronic reflux, of which few important ones includes stricture or a peptic stricture formation. Basically what happens is, whenever there is an acid reflux, when acid tends to trickle up into the esophagus from the stomach, the stricture formation can occur because of chronic acid exposure, where the esophageal lumen is narrowed. Thereby patients will have difficulty in swallowing, which is called dysphagia. And in addition to stricture formation, there can be bleeding from the ulcers which developed because of acid reflux. So in addition to stricture esophagus and bleeding, there is a other complication which is called Barrett's esophagus, which is a separate entity by itself, which occurs because of the chronic reflux. Here Barrett's esophagus is a condition in the lower esophagus which is a risk factor for future esophageal cancer. So these are the broad complications arising because of chronic reflux disease. Thank you.